Good afternoon, Ms. Smith. My name is Dr. Vlad, and I am here to discuss some medical issues that you have been experiencing lately. Due to your symptoms, including the appearance of your rash, the extended bleeding caused by your cut, and your fatigue, we have decided to perform a blood test to check on your platelet levels. Platelets are cells that circulate in your body and come together to help blood clot. The results of the blood test show a decreased level of platelets in your bloodstream. Based on this result, along with your symptoms, I have concluded that you have a condition known as idiopathic thrombocytopenic purpura, also known as ITP. We will have to perform a blood smear and a bone marrow test to confirm this diagnosis. While this may sound scary and intimidating right now, let me take a few minutes to explain this condition further. The exact cause of ITP is not known, and that is why it is referred to as idiopathic, meaning of unknown cause. What we do know, however, is that ITP is a bleeding disorder in which your immune system produces antibodies that attack the platelets in your bloodstream. This attack causes your spleen to destroy the platelets, which results in a decreased ability for your blood to form clots. ITP can affect both children and adults. Children usually develop ITP after a viral infection, but usually recover without any treatment. In adults, however, the condition is often chronic. The greatest risk associated with ITP is bleeding, as the disorder decreases your platelet count in the bloodstream. There are also risks associated with pregnancy. Is there any chance that you will still get pregnant? No? Then okay, we will not worry about those risks right now. Adults with mild cases of ITP can require nothing more than regular monitoring and platelet checks. However, if your symptoms do become problematic, we can pursue other options. The goal of ITP treatment is to ensure a safe platelet count and prevent bleeding risks while keeping adverse side effects under control. The first line of drug therapy will be prescribing you a corticosteroid, typically a drug called prednisone. This treatment can help raise your platelet count by decreasing the activity of your immune system. With extended treatment with corticosteroids, however, there can be some adverse side effects. So if your ITP continues to relapse, we may have to consider other options. There are multiple second-line ITP drug treatments that can also be considered if corticosteroids are not doing the trick. The newest medications approved to treat ITP are called thrombopoietin receptor agonists. These drugs trigger your bone marrow to produce more platelets, which helps prevent bleeding. However, as with other treatments, these drugs can also potentially cause side effects, including headache, joint and muscle pain, dizziness, nausea, and an increased risk of blood clots. With the proper treatment, the chance of remission of ITP is good. Another, more extreme option for treating your ITP is through surgery. The procedure is called a splenectomy and involves removing the spleen. This treatment eliminates the main source of platelet destruction and increases platelet levels, though it does not work for everyone and is associated with multiple risks and side effects. I know I've given you a lot of information and you still need time to process all of it, but do you have any questions for me right now? No? Well, alright. If you do think of any questions or have any concerns, feel free to call or email me and I will get back to you as soon as possible. Thank you.